Hey, this is Jack with ISP Week 1. This is my question remediation. I'm doing 3 questions from PassPoint, 2 on one quiz. These are the same, and 1 on this one. So for my first question here, it's regarding abdominal surgery. Well, that's what I thought was the primary problem here, was the abdominal surgery, but really it's the pain management. So it's a post-op patient, 3 days, with rating of 3 out of 7. Currently, their pain management is morphine, 10 milligrams IM every 3 to 4 hours, and then also acetaminophen every 3 to 4 hours. They're currently taking the morphine, and they've been taking it for 3 days, but they're saying that it's not lasting 4 hours anymore, and they want it every 3. And here it's saying that upon reviewing the chart, it looks like the morphine actually has been providing adequate pain management for that higher severe pain, 7 to 10. And currently they're just rating it a 3 to 7. So really, they're asking, what should we do to help manage the pain? So really, we need to focus on the fact that it's moderate pain. They already are receiving medication for the severe pain. They're not in severe pain. So the intervention that we should be implementing is going to be the acetaminophen with the codeine, because it's not necessary to use a stronger pain management drug, especially morphine. Given that they've had abdominal surgery and it's been 3 days, they really don't need too many opioids to cause, that can lead to a paralytic ileus. They need to be walking around to encourage blood flow. So we don't want to be sedating them or suppressing any kind of drive for them to walk around and, just be participating. So on this one, yeah, we just go with the more mild pain management. It's not necessary to use a stronger one. On this one, I got 2 questions from here. The first one's regarding lactulose. I got a lot of questions through this about lactulose. I just spent 15 seconds on this one. That's because this is not, I've seen a lot of lactulose questions. But I understand it now. So lactulose is going to help balance your serum ammonia levels. So in your patients with hepatic encephalopathy or liver disease, they are going to have higher levels of serum albumin that can cause some cognitive impairments and even lasting damage. So we need to get lactulose is a way to take the ammonia out of the blood. And the way it does that, you can do it through an enema or you can do it orally. The enema is going to kick in faster. It's going to give quicker relief. I saw that it can be within up to 2 hours, actually. So that's pretty fast, whereas with the oral, it's going to take about a day. And the effect of this is you're going to have soft stools. So you're not going to have diarrhea stools. You're going to have more so just soft, 2 to 3, non-diarrheal. So that's what you need to educate the patient about. But yeah, that one, I definitely learned a lot about lactulose. I feel pretty confident in my understanding on it now. The next question here is regarding intramuscular injections, specifically for the pediatric patient. We have a 9-year-old who needs a preoperative IM injection. So typically with an adult, you would use a 20 gauge. That is not the case here, though, because we have a pediatric patient. So what I need to be thinking about is that they need a smaller needle than you would normally use. So that's going to be a 22 because it's a thinner needle. And we also are going to step down to a 1-inch length needle. 1.5 inches is too large. We don't need to go that deep into the arm or wherever we're injecting to get into the muscle mass. So yeah, that's all you got to keep in mind for this is a smaller needle and a shorter needle. And here it's just touching on that. But yeah, normally I like to do remediation on UWorld questions. I like the way that they give information breakdown on there. Sadly, I couldn't find a way to bring up a remediation option. I saw in the GroupMe that some of the other students were also messaging regarding that. I'm not sure if they messaged you, but I saw they also were unable to access the remediation. If I can get it, I'll do it through there. They give really good breakdowns. Here, I don't find it as specific to the question. So it's, Just I don't think it's as good. But I did learn a lot, and I do like the progression mechanic of these quizzes. So yeah, I definitely benefited from it. So if I do have to do this the entire time, that's no issue. Thank you so much.